Good afternoon, everyone. My name is Brian Otten. I am the marketing manager at the Greater Wausau Chamber of Commerce. I want to welcome you to this live webcast. And today's program is on preparing businesses and consumers for a return to commerce. And it's part of our Ready, Let's Grow campaign. You can learn more about that campaign, which is an effort to rally our region around a restoration of our local economy at readyletsgrow.com. Today's program will be recorded and available on the Chamber's YouTube channel later this afternoon. We will have a Q&A portion to the program following Joan's presentation. So please, if you have questions during this program, add them to the chat feature on the left-hand side of your screen, and we will get to them and get to as many of those before the program is finished. What I'd like to do right now is to introduce today's presenter. Joan Theurer is the health officer with the Marathon County Health Department, and I want to thank Joan for making herself available to be part of this program today. Thank you, Joan.
Thank you, Brian. It has been 43 days since I met with you and shared how our healthcare systems and public health system were preparing to respond to COVID-19. I want to take this opportunity to thank the Greater Wausau Chamber of Commerce for their role in keeping you informed and for today's opportunity to reconnect with each of you, our area businesses. More importantly, I want to extend my appreciation for the efforts you've taken to ensure the safety of your workers, their families, and the communities they live in. We wouldn't be in the position of planning for how to safely reopen businesses in our communities without your leadership and your sacrifices. I recognize that Safer at Home has resulted in significant economic hardships, layoffs, and closures of area businesses. Our response has been dynamic and ever-changing, as illustrated by the pending decision to be made by the Supreme Court that we all are waiting to hear. Today, I would like to talk about the Badger Bounce Back Plan released in April. It's Wisconsin's roadmap for safely reopening our communities. The Wisconsin's plan is based upon the guidelines for opening up America again that was issued by the White House and the Center for Disease Control. I am aware of other reopening plans that have been developed by various sectors in Wisconsin, all with the same goal in mind. That is, reopening our businesses and communities safely, knowing that the virus is still here and will continue to infect our residents. In addition to highlighting aspects of the Badger Bounce Back Plan, I will talk about what your continued contributions look like in managing our response. And as Brian indicated, we'll spend a portion of our time together fielding questions that you have. The hardships you and residents are enduring has flattened the curve. When COVID-19 hit Wisconsin, it started to spread very rapidly. Given this is a novel virus having no treatment or vaccine, our efforts as a state and a county have been to slow the virus. The quick spread of the virus created a risk for hospitals to be overrun. We saw this in the media coverage in Italy as well as in New York City. Safer at Home has put in place to slow the spread. We all stayed home, carried out social distancing measures so the virus couldn't spread as easily. We restricted travel, closed schools, not allowed mass gatherings, closed bars, and restricted restaurants to reduce the spike. Safer at Home has saved lives, protected healthcare workers and our first responders, and prevented our hospitals from being overwhelmed. It has given us time to increase our healthcare and our public health capacity to safely reopen. However, we know Safer at Home is not a workable long-term solution for either our economy or our way of life. Safer at Home here in Marathon County has reduced the number of cases we would have seen otherwise. In Marathon County, as of today, we have 22 cases, 981 negative tests, and 1 death. In recent weeks, Plans have been created at national and state level to reopen our economy, including the COVID-19 Economic Recovery Plan that's been published through the Metropolitan Milwaukee Association of Commerce and the Back to Business Plan through the Wisconsin Manufacturers and Commerce and the Wisconsin's Chamber. The Badger Bounce Back Plan is the Wisconsin Department of Health Services roadmap to safely reopen our businesses and communities. The plan is from the perspective of public health science and data. From public health's perspective, 5 conditions need to be in place to safely reopen Wisconsin. These conditions we have been working on at the state and regional and national level. So these conditions include increasing lab capacity and testing, whereby every resident who has symptoms of COVID-19 can get a lab test. Part of that is also that those results are reported back to the patient and to the local health department within 48 hours of collection. The second condition is that we are able to do contact tracing, which is following up with close contacts for every individual who's been diagnosed with COVID-19 within 24 hours of receiving that report. It is also wanting to ensure that anyone who is diagnosed or has COVID-19, as well as their close contacts, are able to be safely isolated and quarantined. The third condition is wanting to assure that our healthcare workers and first responders have personal protective equipment, referred to as PPE, to test and care for patients. The fourth out of the 5 conditions is we want to have our healthcare system be able to respond to surge in the event we see spike in cases. And lastly, we are in the process of building statewide tracking systems to translate and update our public dashboard. I want to spend a few minutes talking about why testing is so important in containing this virus. As a state and county, we've been preparing to move from a strategy where we boxed in people, which is referred to as mitigation, to where we're going to box in the virus, referred to as containment. We want to be in a position where we can test everyone who has COVID-19 symptoms. By doing that, then we are able to ensure those individuals are isolated, basically removed from the community so they can't continue to spread the virus to others. And part of that then is also wanting to ensure they have a safe place to be isolated. When we get a positive case, what we do on a public health lens, your local health departments, we then interview that individual to identify who they had close contact with and who's at risk then for developing COVID-19. That's referred to as contact tracing. So part of that then is calling those close contacts, letting them know that they've been exposed to somebody with COVID-19 and they're at risk for developing the disease, and thereby asking them to stay home and quarantine themselves so they don't spread the virus. By boxing in the virus, we will control the rapid spread of the virus. With no treatment or vaccine, we will need to use containment and mitigation strategies until there is a treatment, a vaccine, or we have what is referred to as herd immunity. That's whereby the majority of our population is immune from the virus. Being able to box in the virus is key in opening up businesses and communities. Given this virus knows no geographic boundaries, we need to assure communities across Wisconsin can carry out these boxing strategies. The Badger Bounce Back Plan identified what is referred to as gating criteria to determine when we can safely reopen our businesses and get people back to work. Last week, the Wisconsin Department of Health Services released their dashboard to track our progress. The dashboard reflects gating criteria indicators, which are shown on the slide to your left, as well as within the actual DHS site, you can see the actual metrics. So the metrics that move us from green to red, or I should say from red to green, is based on statistical analysis and where we're looking for it to be statistically significant, less than 0.05. And so the gating criteria looks at things like how are we doing in people reporting in our emergency departments having influenza-like illnesses. And you can see we are green there, meaning we're in good condition. In terms of the second measure around symptoms, looking at basically syndromic symptoms, so it's basically COVID-like symptoms, and what is happening over a 14-day period. You can see at this point we are still red. The other criteria then looks at cases and how are we doing in having a downward trajectory in terms of the percentage of total cases over a 14-day period. And again, while we've had a downward slope in the last several days, we still are at red in terms of it being statistically significant. And then under gating criteria, the last category looks at hospitals, and three areas there is the treatment of all patients without crisis care. Do we have a robust testing program for at-risk healthcare workers? And do we see a decrease in the number of infected healthcare workers? Two of those measures, the being able to care for crisis care as well as robust testing program, is still in the process of collecting that data, and the last update on the web page said that that would be posted today. And you can see under healthcare, we still are red and have not achieved green. I want to share that the Northern and Western Regional Health Officers, my counterparts, along with our regional healthcare readiness coalitions, have developed a plan that integrates the state's gating criteria you see in front of you with the metrics that were in the COVID-19 economic recovery plan that the medical college worked on, identifying metrics for considerations. Those measures that we are looking at, in addition to what is here within the gating measures, is also the number of cases over 14 days, looking at testing availability for all folks within our communities, hospitals being able to treat all patients, again, without crisis standards, availability of PPE, and our ability to count, trace, and monitor COVID cases and outbreaks in real time. Work is underway to have a local and regional dashboard, so we have metrics to monitor the impact and our response to COVID-19 as our communities reopen. We've taken a look at the Back to Business plan developed by the Wisconsin Manufacturing and Commerce and the Wisconsin Counties Association, and the four factors to look at in determining the level of risk. Two of those four factors do support the metrics in the Badger Bounce Back plan, and those include infection rate in the county of operations, as well as healthcare capacity and utilization in the county of operations. Taking a look at things, how available are ICU beds, availability of PPE, and ventilators. In addition, the plan looks at population density of a county of operations, which is something to consider because we know denser a community is, the greater risk for transmission. And the other factor is the interactive concentration, looking at risk based upon the type of business and industry, knowing that there are different risks involved depending on the nature of the business and industry. All these measures, there's a lot of measures here, and many of them are supportive and similar, but all these measures will be important in determining how we will further reopen our communities. These measures will be also critical in monitoring our response in the months to come and determining if we may need to put in place temporary measures to avoid overrunning our hospitals. There has and continues to be discussion of the merits of looking at regional reopening. The challenge in carrying out our response solely at a local or regional level is the virus knows no geographical boundaries. Our communities are interwoven across geographic lines. People living, shopping, working in different communities. What is happening in Eau Claire, Madison, or Green Bay can impact us locally. The Badger Bounce Back outlines a phase-in approach, which will be critical to avoid or reduce the impact in terms of the number of surge of cases we will see. The plan outlines actions individuals and employers need to carry out. Individuals will need to continue to practice good hygiene, stay home when sick, contact their healthcare provider, and social distancing. For businesses, phases will continue to be looked at as we move forward here, and controlling for things like social distancing until we are in phase 3 of the plan. So you can just see when you look at the various phases and the actions in terms of physical distancing, you can see that's all the way across until you get to phase 3, where that's not necessary anymore. Gatherings, because we know, again, if people are large groups, greater risk for being able to transmit and for other people's to acquire the virus. You can see again, until we get to phase 3, we need to be looking at controlling the number of people that are together as a group. And then just walking through that, you can see where restaurants are. In phase 1, we open up with best practices, and best practices, it's noted that people over the age of 60, including employees and those who are medically vulnerable, advising them to continue to shelter in place. And bars looking at phase 2 with best practices, being able to open up, and then opening up essential businesses, continuing with retail restrictions removed in phase 1, and then under open non-essential businesses, you can see looking at partial reopening, and then phase 2, where they would open with best practices. Last portion of this, in terms of highlighting what's in the plan, it looks at then our schools as well as our daycares. Looking at the very bottom, you can see volunteering quarantine of travelers from high prevalent areas will continue through phase 3. So wanted to spend some time in terms of just reinforcing the best practices for our businesses in reopening up safely. The practices that are outlined here are in keeping with the Badger Bounce Back plan, as well as the Back to Business plan, and also in keeping with what you will see from our Department of Health Services website, as well as CDC. So looking at like 4 categories. The first one is to enact procedures and protocols to mitigate the introduction, exposure, and spread of COVID-19. For folks who already have put in place continuity of operations plan, this is a great time to review those and to adjust them as needed. Asking folks to continue to follow the federal, state, and local department regulations and guidance, as well as to review your policies to minimize business as well as personal travel. In looking at employee health, continuing to reinforce hand washing as well as masking, and to continue to carry out symptom screening, to send and keep workers who are sick home. In addition to that, looking at just monitoring absenteeism, we know that where there has been outbreaks, if we look back, we could have maybe seen that there was an increase in the number of workers who were absent, which may tip us off that something is occurring within your own workplace. And then along with that, you play a really critical role in supporting the isolation and quarantine of employees with COVID-19, as well as those their close contacts. In looking at on-site practices, continue to think about and look at how you can set up workflows so employees are 6 feet in distance. Use of staggering use of shared spaces, break room, lunch rooms, using posters and other reminders of what 6 feet looks like. Continue to look at how you can stagger shifts and work hours to minimize the presence at any one given time. Continuing to look at having who can work from home whenever possible. And then continuing to limit in-person meetings, continuing to communicate virtually through phone, as well as various platforms that are available out there. And when you're thinking about those for retail, for restaurants, and others who are inviting the public in, how do you set up your spaces so the public is 6 feet in distance? And so really what you're doing is creating environmental engineering structures so people are reminded, are able to keep themselves 6 feet away, and as well as providing hand sanitizing and promoting masking. And then lastly, we have to continue to keep in mind our physical environment in terms of ensuring that there's routine cleaning, disinfecting, shared work surfaces, as well as equipment and tools in high traffic areas. And guidance continues to be made available by your setting. So I would just encourage taking a look at the nature of your business and risk involved. What are the specific practices in addition to these general ones that I covered? In closing, as we continue down the path of reopening businesses and communities, it will be critical that we continue to be diligent. So the word diligent is really important. Diligent in being intentional and untiring in carrying out our practices for the health and safety of our residents. I want to take this opportunity again to thank you, to be able to meet with you. And at this time, I can open it up for questions. Hand it off to you, Brian.
Sounds good. Thank you for that presentation. The first question we have here, Joan, is from Corey. It's related to the volume of testing and the 14-day consecutive downward trend metric. Isn't it sort of help us to understand if there's more testing, wouldn't that 14-day consecutive trend be much more difficult to sort of achieve in terms of doing that consecutively?
That's a really good question. I think there's a couple factors involved, and yes, I thought that same question. So if we're testing more, are we going to see an increase in the percentage of cases? And I think one thing to keep in mind is because we've had limited testing up until recently, we were prioritizing who would get tested. And so our priority was those who were critically ill and our healthcare workers and other occupational risk as well. For example, our first responders. So as we've had increased testing tests available, we actually are testing a larger percentage of our population. Also keep in mind that as our hospitals are slowly trying to return to some normalcy, they are now beginning to do elective procedures. So anybody who has an elective surgery, they're being tested, and they are being tested even though they're not symptomatic. So the number of people we're testing is significantly larger, and the level of risk is less than it was initially. So hopefully that answers your question, Corey.
Joan, could I ask you to rewind your presentation to the slide where it showed the quarantine recommendations for out-of-state travel? If you could do that while I ask the next question.
Okay.
Thank you for doing that. That was Lisa's request. I have a question here from Terry. Is there a website that shows the status and trend of positive tests as a percentage of the total?
It does. Actually, if you go to the State of Wisconsin Division of Public Health and click on the banner that says COVID-19, it'll take you to their landing page. Then you click on your right-hand side, you'll see something called Outbreak Investigation. And then you click on that, and then on your left-hand side, and I'm already thinking, Brian, I'll have to send you the site specifically so you can get this out. But if you look at the left-hand side, they actually then have the Badger bounce back plan and the gating criteria. So when you click on the gating criteria, you'll see the actual indicator in the metrics, and it'll look at the percentage. And just to let you know, because I have it printed here, it has been bouncing around. We had a high of 13% several days ago, and I think today when I looked at it, it was, if you can hang on so I can quote you accurately. So for example, May 1st, it was 13%, and as of yesterday, it was 6%.
Okay. Thank you for that question, Terry. We had two questions in a row, one from Dylan, one from Corey, both related to the timelines as far as the various phases that you mentioned. I guess in your professional, Corey words it this way, in your professional opinion, how long do you think this will continue?
The pandemic as a whole, that's a great question. It really is going to be based upon those factors of, do we have treatment? Do we have a vaccine? Or do we have what's called herd immunity, which means the majority of our population has had the virus, and therefore it is less likely to spread from person to person. What I've been hearing is anywhere from 12 to 18 months in terms of, and that's looking at things, in terms of optimism around having vaccine. And so we may get lucky and have a treatment. So those who, when they do get COVID-19, get really sick, we have a way of treating them. And in terms of moving through each of those time phases, I know everybody would love to have dates like, okay, when can we move to phase 1? And how long do you think we're going to be in phase 1? When do you think we'll be in phase 2? And if I had a crystal ball, I would love to share those dates with you, but it's really going to be dependent on our practices as individuals, as in our families, as well as our businesses, in terms of carrying out that social distancing. Because if we're really diligent about being mindful. So if we're out in the grocery store or out in big box store, that we're maintaining our distance from people, that we're not chatting away with our neighbor that we haven't seen for 2 months in close proximity, that we are conscious that if we can't maintain 6 feet of distancing, we're carrying out and using masks. And we create that environment within our businesses, we will be able to move quicker through those phases.
Okay, thank you, Joan. I have a question of my own, I guess, before I forget. I saw that there's going to be some, I think it's drive-through testing in both Wood County and Portage County. Are there plans for something similar to that here in Marathon County?
That's a great question. We, as of yesterday, submitted, it's called a request form to the National Guard, and I have a conference call scheduled for Monday. We are looking at doing, the request is to do something jointly with Lincoln County, and so more will be shared when we find out.
Okay. Lisa, who asked to see the quarantine recommendations about out-of-state travel, she's asking if you could go back 1 or 2 more slides, if that's possible. And the next question comes from Samantha. She asks if you could if you could define treatment without crisis care and sort of articulate, is that the state of the hospital or type of care being provided to the individuals?
Good question, Samantha. When we talk about being able to treat without crisis, it means that our healthcare workers have adequate personal protection equipment. It means that if there is an exposure, they're able to be tested, and that the actual individuals who come for care are, if they need a ventilator, they will be able to receive a ventilator.
Okay, thank you. Jessica asks, in regard to the phase 1 part of the plan, if there's a 10-person maximum, is that per building or per room? Keeping in mind that there's a 6-foot social distancing requirement, what's the definition of a gathering space?
That is a really good question, and I guess I'm not going to answer that because I would be speculating on what it means. I have heard people talk about it being a confined space, so a room. But I guess what I would, people can start thinking about that in your planning, and at the point we are at phase 1, I anticipate we will get really specific guidelines for that.
Joan, Corey asked, were there health departments that were involved, do you know, and maybe the Marathon County Health Department in specific, that were involved in creating the Badger Bounce Back plan?
I'm trying to figure out how to answer this question in terms of our involvement. What has happened, or what is happening, has been happening, is on a daily basis, local health departments are on a call with our deputy administrator for the Division of Public Health. And it is our way of sharing kind of what we're seeing at a local level, the impact of the policies and the recommendations and the orders that are being given out at a state level, as well as for them to bounce ideas off of us in terms of what they are planning and how that will impact us locally. Did we see the plan? Did we have specific input into what is here? not necessarily, but we definitely had input in terms of what we thought were some important conditions. Things like, we know that testing is really important. We know that in terms of public health capacity, we know that we need to be able to respond to that report of somebody with COVID-19 and do the contact tracing as soon as possible to stop further spread. And we also know that hospitals have to be able to care for people without doing it under a state of crisis. So I would say the concepts, we definitely reinforced what was important, but actually seeing the plan, reviewing it before it was released, we did not have input into that.
Okay, thanks for Joan for that answer. We've got another question here from Lee Shipway. Lee is asking about herd immunity, and is it correct that 30% is the sort of the standard to achieve herd immunity?
Herd immunity, usually it varies depending on the virus. So it can be anywhere from 80 to 90%. I have not read this, but I heard this from a public health official at a national level talking about herd immunity for this maybe being around 80%.
Okay. The question from Julie, and I think you may have touched on this a little bit in your presentation, but can you just quickly review, does the Badger Bounce Back Plan have specific markers for moving from phase 1 to phase 2 and then from 2 to 3? Is there anything that you can sort of highlight in terms of markers in that way?
Great question, Julie. My sense is, because again, the challenge we face, I think, sometimes at a local level is we don't get the full extent or the rationale or the background in the plans that are being developed here. And so my sense is what is going to happen is those indicators and those metrics that are posted on DHS's website are going to be used as our monitoring tool. So if we see that things continue to be flat or decrease, it will inform us then we're probably ready now to move on to phase 2. That is what I am thinking. I have not been told specifically, but that's what I'm thinking is going to a measure that's going to be used, or measures that are going to be used to make those decisions.
Okay. I think that addresses Jack's question. Thanks for that question as well, Jack. Thanks everyone for the questions. We've got a few more here. Let's see. As far as the 14-day quarantine following travel before coming back to work, does it matter where people are traveling to? I mean, does that apply only to travel to hot zones or international travel, or does that apply to traveling over state lines, or even less, I guess?
Yeah. Under safer at home, right now people are saying to quarantine when you're returning from a community where there is COVID-19 activity. So you look at Wisconsin right now, it's hard to come up with where you could be without looking at having to be quarantined. And our guidance is a little bit more rigorous than CDC's. And I think part of what you have to look at is, as a business, what makes sense for your business in terms of business travel, as well as what makes sense for your employees for their personal travel. Here at Marathon County, for our government, we have guidelines that talk about business travel. We're basically restricting people from traveling for business unless it's critical for the work that needs to be done. In terms of employee travel on their own personal time, we're also asking people to restrict that and stay within their home community. And if they do need to travel outside their home community right now, it's being asked that they communicate that with their supervisor, and then it is looking at each case in terms of the level of risk. If somebody right now said, I want to go to Green Bay and hang out with a group of friends, and then the next day go to visit some of my family, and then go back and visit some other friends, that would be a red flag for us, saying, I think you're going to have to self-quarantine for 14 days. So it really depends on what your business practices, the nature of your business practices, as well as what you would like to do with your own employees, depending on the risk involved in their personal choices.
Thanks. And thanks for that question, Kristen. And we have another question from Roxy asking if you can articulate what the difference between routine cleaning and disinfection means.
Yeah, routine, well, when I talk about disinfecting on a routine basis, maybe would be a better way of saying it. So routine cleaning, I would see as you vacuum the carpet, you take a dust cloth and you wipe off and dust off a surface. Disinfecting means you're using a solution that actually kills or reduces the virus on surfaces. So that's the distinguishing difference. And if you want to learn more about what those disinfectants might look like, you can go on the DHS website, or CDC actually has information, and you can make your own using bleach and water.
Okay. Jeff asked if you can provide any local perspective on the saliva test and any impact it would have on the reopening criteria.
So there's two tests that are available right now. One is called a molecular, and that actually detects whether or not you have virus right now in your body. And how they do that is it's a nasal swab, or it's called a basal pharynx swab that goes into the back of your throat to test for that. That test is really accurate and provides us good information. There's another test now that's being talked about a lot, and it's called serology, and that looks at whether or not you're immune. And what it would mean is at some point you had COVID-19. It is something that we see as promising in terms of kind of getting a picture of, in a community, since we know that there are people who get COVID-19 that have no signs or symptoms, it would be a way to kind of take a look at a community to determine, well, how much COVID-19 actually occurred in our community. The challenge with serology right now is it's still under development. A lot of research needs to be done. It's not very specific in terms of detecting only COVID-19. It can detect other coronaviruses or other immune conditions in a body. So you might end up saying it was positive, but it could be because you had a cold virus, or you have a different immune compromising condition. So we're definitely interested in learning more about it and look forward to the research that is underway, because it will help inform us the impact of this pandemic at some point.
Thanks for that question. And Angela has a question regarding school. Do you have any thoughts on if students are going to have to be kept 6 feet apart? I mean, I'm guessing this is related to the phases, but when school resumes, hopefully in the fall or in September or late August or whenever it's going to be, do you foresee students being separated in that way?
I could see students being, how do we create some physical barriers? So distancing, as well as maybe more smaller, where you might have 10 kids or 10 children together. It's going to be, I know DPI is at this point actively looking at what those plans would look like, but distancing will be something that we will want to keep in mind. So it's a great question. I wish I had an answer for you, Angela, and I think we're going to have to wait and see what those recommendations are going to look like.
Great. I have one final, or I guess just as a point of clarification to wrap up here, we're pretty much to the end of the questions. The information that you've provided, Joan, that you've taken this from the Badger Bounce Back plan, correct?
Yes, the information, the last slide, which I'll just go to, this slide is a combination of things from the various plans. So the plan that was released from the Metropolitan Milwaukee Chamber had some recommendations. There are recommendations in here from also the Back to Business plan that was released by the Manufacturing, Commerce, and Chamber at a state level, as well as the Badger Bounce Back. So it's a combination. The remainder of the information comes from either the state of Wisconsin division of, I should say, Wisconsin's Department of Health Services and or the Badger Bounce Back plan.
Okay, great. So we have questions. Joan, I want to thank you for spending this time with us today. I appreciate your involvement with this. I invite individuals who are looking for resources, whether it's on a individual or business level, to visit the Ready Let's Grow site, readyletsgrow.com. Also visit the Chamber site, wausauchamber.com. We've assembled a lot of different resources for, again, individuals and businesses there. To close, this presentation has been hosted by the Greater Wausau Chamber of Commerce. The content of this presentation does not necessarily represent the position of the Chamber regarding the Badger Bounce Back program. It's intended to educate everyone that's out there in our audience. And I thank you for the time. Thanks again, Joan, for being part of this program. And I wish everyone a happy and healthy weekend. And we will see you with additional webinars in the near future.